talking about the multiple pregnancy. So multiple pregnancy refers to a situation in which more than one baby is inside the womb of a pregnant woman. Commonly, what we see is one baby inside the womb, but when we see two, three, four, five, sometimes six, seven, eight, so we call it grand multiparity. So, but in this case, we are focused more on twin pregnancy and triplets. So if there are two babies in the womb, that's twin pregnancy. If there are three, it's triplets, and if there are four, it's quadruplets. So in this situation, we are very careful because one baby is enough to stress the woman. How much more two and three and more? So one of the things that we consider in this kind of pregnancy is the safety of the babies, because in a situation whereby a space in the womb where just one baby is supposed to stay, we now have two or three, then we begin to see cases of competition. The babies will start competing for nutrients, they will start competing for space, they will start competing for even oxygen, everything that they need to survive. And sometimes you see a case whereby one of the babies will be big and the other will be small. So we are very careful about this kind of pregnancy. A woman who is pregnant with two or more babies would most likely have to come for more antenatal visits, because at any point in time there can be complications, and it's important to pick these complications early. So we do serial ultrasound scan more frequently than if it's just a single baby. And when it comes to the time of delivery, we want to have a high index of suspicion of any complications, because there are two babies now. There's high risk of cord around the neck, there's high risk of one of the babies dying, there's high risk of obstructed labor during delivery. So all of these are important. So if anyone has twins or triplets, they should be closer to the hospital, so that if there's any signs of complication, they can quickly come and the appropriate interventions can be made. And one of the scary things for people who have twin or triplet pregnancy is that they usually say that probably they have to deliver through cesarean section. It's not always true. If there's no clear indication for cesarean section, nobody would ask you to do a cesarean section. But if there's a risk to the mother or the babies, then we have to intervene. What is most important is that the babies are alive and the mother is alive. So multiple pregnancy is always welcome. It's a form of pregnancy that we are happy about. Nobody does not want to have twins or triplets, but it comes with some complications that has to be prevented early. Thank you.
Gift clinic,
healthy baby,
gift clinic,
healthy mother,
gift clinic,
satisfied
African death,
no more maternal death.